My name is Wagnew. I am currently taking the responsibility of Nutrition Officer for Medical Teams International, MTI, Shira Field Office. Following the conflict that erupted in 2020, Medical Teams International started emergency life-saving activities through its mobile health and nutrition team as a response to the armed conflict that erupted in 2020. But at that time, we were thinking to start sustainable and continued healthcare activities. That's why MTI switched its service modality to health system strengthening since April 2024. When we come to Mahalnash's story, Mahalnash is an internally displaced mother of 2 children who left all her belongings and household items back at her original home. And she managed to reach to Shira town after so arduous journey on foot. And after she stayed for about 2 weeks in the villages of Shira area surrounds, and later on she managed to take a shelter in Dahab Tasfai internally displaced persons shelter site or IDP site. With our community engagement activities with our IDP communities, we managed to have Mahalnash as one of our mother-to-mother support group members that we selected and trained on infant and young child feeding practices for 1 day, and she's among those mothers who took the IYCF practices 1-day training. Following that, she is providing a house-to-house education or awareness creation sessions to mothers of her IDP site, which particularly includes an awareness on when to start antenatal care follow-up without any interruptions, and she reassures mothers to stick with the advice the clinicians provide them. And she also teaches mothers when to start breastfeeding, usually immediately within 1 hour of birth. And then she also educates mothers to provide only breast milk or to feed their children only breast milk up to they are 6 months of age. And then at 6 months of age, she educates and demonstrates how to prepare the complementary food, and she also educates the items or the ingredients of the enriched complementary food, that's actually porridge. She teaches them they should start at 6 months of age, and she also demonstrates how to cook or how to prepare that enriched complementary food. And she, at the same time, she also educates mothers that they should sustain breastfeeding up to 2 years and above with the complementary food provision after that starts at 6 months. Trained 1-day training, but also she is also empowered through our nutrition officer and the health extension workers on a regular basis at her IDP site. So we join her sometimes to do what actually is teaching, what actually she is showing mothers to prepare the complementary food. I think this story shows what Medical Teams International in action is. We are a dedicated medical organization providing comprehensive health and nutrition services to our community, not only just providing medical care, but also the awareness creation sessions at community level.
ካብ ጥንሲ ካብ 2 ሰሙን ጀሚርና እስካብ ዝውለድ ዘሎ ህፃን እናተኸታተልና ምስ ዶክተርና እስካብ ምውላድ በፂሒና ብድሕሪ ምስ ተወለደት ህፃን ሽዑ ምስ ወለድና ህፃንና ጡና እንቀሳቂስና ብደንቢ ኢና ነጥዎ ስቐጥና በልና ሽዑ ክጠቦ ይኸንን ህፃን ዓልና ድጋፍ ጌርና ነጥዎ እስካብ 6 ወርሒ ማለት እዩ ክነጥዎ ከለና ህፃንና ካው መጀመርያ ጡና ብደንቢ ይኽጠዋ ዝኽእል ንሳ ምስ ጠዎ ኢና ናብ ሓንቲ ጡና ከነስግሮ ንኽእል
level. That very describes Medical Teams International is dare to love our people like Jesus, and we boldly break barriers to reach our community, both the IDPs and host communities. And it's not only in the IDP site only, but also we are also supporting healthcare facilities to strengthen the health system. By doing so, MTI is not just responding. We are recreating resilient and sustainable healthcare systems in the intervention areas that we are assigned.